guys, it's Khaki. I have a clip on microphone that I am trying out for the first time this week. I'd had some feedback that it was kind of hard to hear me, so I'm hoping this helps. Let me know in the comments below if it does. Today, we're going to talk about a subject that is very common for those of us who have had weight loss surgery, but can be an uncomfortable topic to talk about. We are going to discuss constipation after weight loss surgery. And for any of you who have had weight loss surgery, you know this can be a big struggle. My own personal experience prior to weight loss surgery, I actually had irritable bowel syndrome with diarrhea. So I'd never had constipation before I had my gastric bypass. Since then, it has been a struggle, especially in that probably 3 month to 1 year post op period. That was when it was the worst. Although it still can be an issue. I've struggled with it the last few days. So let's talk about it. What causes constipation after weight loss surgery? One of the things, especially in the early stages, is a decrease in fluid intake. We just don't get in the fluid. Swallowing is harder of large volumes, so we tend to sip, which is what we should do to avoid pain, but that leads to a decrease in fluid intake, which then can lead to constipation. It takes fluid to push waste out of your body, and when you don't have that, constipation can happen. And by the way, these are the same causes for constipation, some of these in people without gastric bypass or other weight loss surgery. But some of these are really specific to our situation. Another thing that causes constipation after weight loss surgery is a decrease in fiber intake. We are very protein focused, and it is hard for us in those early stages, especially, to get in enough of the cruciferous vegetables that are high in fiber, and certainly the whole grains that are also high in fiber. This leads to constipation. Another thing is, especially here again, those early stages, a lot of us are very tired. We're getting in very little caloric intake. So we're not as active. That, inactivity or decreased activity certainly can cause constipation. A big thing that I see professionally in my practice that causes constipation. We had a glitch. So, anyway, carrying on. Another thing that I see causing constipation in all types of patients who require iron supplementation. That is a big cause of constipation. I have so many patients with anemia who we have to supplement their iron who will stop taking it due to constipation. For those of us who have had weight loss surgery, most of us, especially those who have had a bypass or duodenal switch, we have to take iron or it can lead to catastrophe. There we go with constipation. Calcium supplementation can also cause constipation, which most of us, I'd say nearly all of us, need to be taking. Increase protein intake. A lot of us prior to weight loss surgery had a very carb heavy diet. We did not get the amount of protein that our bodies needed. Now that focus shifts to making sure we get that protein in, so we're eating less carbohydrates. Increased protein intake can cause constipation. And finally, well, not finally, but one thing that a lot of people don't realize, those new injectable weight loss drugs that started out as diabetes treatment, GLP-1 hormone drugs like your Wegovy, Zepbound, Ozempic, it's marketed by several names. When you have weight loss surgery, that your GLP-1 hormone levels go up, much like you're taking those injections. An increase in GLP-1 hormone can cause constipation. It decreased food intake. It takes intake to make outtake. So if you are not getting as much food intake, you're going to make less stool. It very well could be that those of us prior to surgery who had daily bowel movements, that's not going to be our norm anymore due to decreased intake. It doesn't necessarily mean that we're constipated, it just means our new normal is different. Also, the change in our anatomy. We have less colon, less bowel, basically, and that causes a big change in the way that our bodies process food, which can lead to constipation. There are the causes. So, what are the complications of constipation? People think about, oh, I'm constipated, it's uncomfortable, I feel bloated, I feel kind of sick. But there can be serious health issues related to constipation. Constipation, especially when you're having to strain, can cause hernias, which there can cause problems, can require further surgery. Constipation can cause hemorrhoids when you're pushing to strain, which can lead to further surgery. Or in some cases, I've actually seen hemorrhoids which start to bleed, which cause anemia, which many of us are on the guard to prevent anyway. So we don't want to do anything that can cause that. Another thing that constipation can cause, when you have stool that is hardened sitting in your colon against the wall of the colon, that can actually cause that area that it's putting pressure on to die, to become necrosed. That can be a very, very serious issue, which can lead to death. It can also, but prior to that, most people do have a lot of pain. So when you get that serious of constipation that it has led to death of tissue, usually, well, always, that requires a surgery to go in and resect that colon and take out that necrotic part before it causes problems. One very rare complication of gastric bypass, less so of gastric sleeve, but certainly of duodenal switch as well, is one that a lot of us became aware of after Lisa Marie Presley passed away from a small bowel obstruction, which was, they say, sequela of a gastric bypass many years before. A small bowel obstruction causes a unique set of symptoms. The obstruction, a lot of times it can be due to scar tissue, which has nothing to do with constipation but can cause constipation. The scar tissue or hardened stool can obstruct the small bowel. Usually, with that, you're going, or any case I've ever seen, you have pain, severe pain. You have indigestion. A lot of times you're going to have vomiting. These are serious things to worry about. So if you have these symptoms, here again, it's very rare, but that is a medical emergency that requires treatment. So we've talked about what causes constipation, what constipation can cause. Now let's talk about what we can do about it. First off, work on getting your hydration in. Try as hard as you can to hit that minimum 64 ounces of fluid a day. Sip constantly. The more fluid, the better when it comes to having good bowel movements. Stool softeners. I tell my patients, start a stool softener pre-op. Do it every day. I have taken one ever since I have had gastric bypass. And I think that it hasn't prevented constipation, but it's prevented it from being worse. Another thing is try to up that fiber intake. I know it's hard, especially in those early stages, and sometimes it's just not possible. But focus on when you're able to start eating vegetables again. Look at the fiber content. When you're able to start reintroducing whole grains, look at the fiber content. You may require a fiber supplement like FiberCon, something that is a powder that you dissolve in liquid to increase your fiber content. Miralax, now over the counter, it's a powder that you put in water or any kind of liquid. It requires a couple of days to work. A lot of times, people have to take it on a daily basis to prevent constipation. Dulcolax, which is also the generic name of that is Bizacodyl. That is an over the counter laxative. I would not recommend use of it every day, but when things get bad, when the stool softeners, when the Miralax is not working, that's a good option. There are some herbal remedies that you can use. One thing that I've used in the past, it's a tea called Smooth Move. It's a senna based tea. I'm not a fan of the taste of it. It tastes kind of slimy to me. I will put some of my skinny syrup, sugar free syrup, in it to kind of sweeten it and mask that taste, but it does work. Finally, there are prescriptions that you may have to take. I have taken a prescription medication called Linzess that is safe, according to my team, for post bariatric surgery patients. Another thing that I have used in that patient population is Amitiza. Uh, Really good. I like the Linzess a little bit more because it's once a day, where the Amitiza is twice a day. Not a laxative, but it does encourage regular bowel movements. Probiotics, another thing that we can do to add in on a more natural sphere. Helps some people, doesn't help others, but it's not going to hurt. So, that is the skinny on constipation after weight loss surgery. If you're comfortable sharing your tips, tricks, your experiences, I would love to hear them. I would also love to hear any suggestions for future videos. I've had this suggestion several times, so thanks to the viewers who suggested it. Let me know what you'd like to hear. I hope everybody has a great week, and we will see you next Wednesday. Bye.